Welcome everyone to today's event. I'm absolutely delighted to be able to open today's launch event for the new sign guideline on dementia. I'm really disappointed I can't be with you in person. I know the value of days like this and coming together to celebrate the hard work that goes in to develop guidelines like these. Huge thank you to everyone who's played their part. I know that today's event will allow for rich discussions on a wide variety of work that Healthcare Improvement Scotland and partners deliver to improve the lives of people living with dementia. Looking to the agenda, the range of voices being brought together will help to illustrate the importance of the guideline, how they were developed, and how they're already starting to be implemented. I particularly welcome the inclusion of lived experience voices in today's event and in the development of the guideline itself, ensuring that their voices guide our efforts to improve the experiences of our dementia communities is absolutely critical to all of our work. And that includes in setting national policy through our strategy, which I'll touch on later. The guideline provides, through its recommendations based on current evidence, clear best practice in the assessment, treatment and support of people living with dementia. The guideline applies to all settings, including home, long-term care, care homes, hospital, hospice, daycare centres and primary care. Its recognition of health inequalities is to be particularly welcomed. We know that people's experiences of living with dementia and their potential likelihood of developing the condition absolutely needs to be seen through this lens. Such a focus has to be at the heart of our work going forward, including in the delivery of our strategy to help guide our interventions in the right way to address these inequalities. Now, I also really welcome across the recommendations the focus on making care and support more person-centred. I've been clear that across health and social care settings we can and we must move towards support being person-led wherever possible. The recommendations this guideline sets out will help us to move towards this ambition in dementia care, and I really look forward to hearing of its progress as it becomes embedded in practice across Scotland. I also recognise the importance of this new national clinical guideline and how it can support the delivery of our new dementia strategy, which I launched alongside Councillor Kelly from COSLA earlier this year. The strategy sets out an ambitious 10-year vision for dementia policy in Scotland, developed in collaboration with people with lived experience and wider partners. And I know a number of you in the room inputted into this shared vision. This 10-year vision is of a Scotland where people living with dementia have their strengths recognised, their rights upheld, and where they, their families and care partners, unpaid carers, are supported to live an independent life, free from stigma, with person-centred treatment and care when and where they need it. We've always known that the publication of the strategy is just the first step in a longer process. And our initial 2-year delivery plan will set out how we begin to realise this vision. Recognising we're at the beginning of a longer term process, the first plan seeks to establish core building blocks for delivery, and these will carry through to our subsequent delivery plans and ensure how we deliver actions and hold ourselves accountable brings about a new way of working in dementia policy, one that addresses the gap between policy and experience. Now, I know that some of you here today will be involved in the working groups that are informing and shaping the strategy's first 2-year delivery plan. I look forward to monitoring the progress made in partnership with yourselves, the voices of lived experience and other partners. We're all motivated by improving the experience of people living with dementia in Scotland, and agreeing the first delivery plan moves us towards delivery of our shared ambitions in a meaningful and measurable way. Now, in order to achieve our ambitions, we need a skilled, knowledgeable and informed workforce, and it's recognised that the dementia workforce is diverse, with the Promoting Excellence framework remaining as one of the core frameworks for learning and skills. The new sign guideline on dementia, therefore, provides another incredibly important tool for practitioners to ensure the highest quality delivery of dementia treatment, care and support. Your expertise, your knowledge and your experience informed this new guideline. We need it to inform delivery on the ground and to change practice, because that's where we'll make significant difference to people living with dementia and their care partners and unpaid carers. I'm going to close it by thanking you again for your ongoing commitment to this work and for widely collaborating to develop this new guideline, which will improve the lives of people living with dementia and their care partners. I look forward to continuing our work with you as we seek to enhance the experience of our dementia communities in Scotland. Thank you.